Good day, guys. You're welcome to this MCQ review for the Part 1 MBBS exam. So this will be our first MCQ review. We'll be reviewing about 100 questions in this folder. So an outline for the review will cover 20 MCQs in clinical enzymology. This was how I gave you guys in class that day, 15 minutes. So 20 MCQs in lipid chemistry, 20 MCQs in carbohydrate chemistry, paper 1, 2, and 3. Paper 4 with 20 MCQs on vitamins and nucleic acid chemistry. And paper 5 is 20 MCQs on amino acid chemistry, protein structure, and protein purification. So this will be the outline for the MCQ. So in this video, I'll start with paper 1, 20 MCQs in clinical chemistry. Question 1 says, glycogen phosphoridase, which mobilizes glycogen for energy, requires which of the following as a cofactor? The answer to this is pyridoxal phosphate serves as a cofactor for the enzyme glycogen phosphoridase, which breaks down glycogen into glucose 1-phosphate. So it breaks it down, clips off the glucose molecule from the glycogen molecule, and then phosphorylates it on the first carbon. That's what it does. It requires pyridoxal phosphate as a coenzyme. Question 2. Choose the incorrect statement about active sites of an enzyme. So the active site of an enzyme is a three-dimensional cleft. That's true. The active site takes up a large portion of the total volume. The large portion makes it incorrect. So this is the incorrect option. Question 3 says, any of the following processes except one are involved at the active site of an enzyme to accelerate the rate of a chemical reaction. Bond strain, catalysis by bond strain is very correct. Catalysis by proximity and orientation is very correct. Non-covalent catalysis is not correct. What we have is covalent catalysis. So this is the wrong option. There's acid-base catalysis is also very correct. So there's nothing like non-covalent catalysis. Question 4 says, a given substrate may be acted upon by a number of different enzymes, each of which uses the same substrate and produces the same product. The enzyme, the individual member of a set of enzymes sharing such characteristics are known as isoenzymes. Option B is the correct answer. Question 5. A recently diagnosed hypertensive patient has been prescribed an ACE inhibitor, e.g. captopril, as angiotensin convertase inhibitor. So, which is known to lower the Vmax. So let's say this is the Michaelis-Mentel's graph now. This is a normal Vmax here. So if we have a lowering of the Vmax, especially when Km remains the same, what this means is that there is a non-competitive inhibition on this drug in particular. So what happens here is, what is the possible mechanism of inhibition of this drug? It's non-competitively inhibiting the enzyme, I mean to say. So that's what this drug does to the enzyme. Question 6 says, which statement out of the following is incorrect about the effect of increasing temperature on enzyme activity? The answer is, the storage of enzymes at 5 degrees Celsius or below is generally not suitable. That's false. That's incorrect. Question 7. A 54-year-old man was rushed to the emergency where he collapsed in the middle of a business meeting. Examination revealed excessive sweating and high blood pressure. ECG chest was conclusive of an acute myocardial infarction. Which biochemical investigations out of the following would be of no help in confirming that? So let's say this is the heart, and the heart was damaged. The heart cell was damaged, the myocyte, and this is the bloodstream. Enzymes and proteins within the myocyte that was damaged would leak into the bloodstream. So if we check for these proteins, it could point to us that the myocyte is actually damaged due to the acute myocardial infarction. So which of these proteins would we be looking out for in the blood as a signal that the heart is damaged? Cardiac troponins is very correct. Serum myoglobin is very correct. Creatinine phosphokinase MB is very correct. But lactate dehydrogenase is not heart specific. So this is the odd one out. We don't need to know lactate dehydrogenase in case of acute myocardial infarction. Question 8 says, a coal mine worker was brought in an unconscious state to the emergency room after a blast in the mine. His blood carboxyhemoglobin levels were high and he was diagnosed of carbon monoxide poisoning. Carbon monoxide is a known inhibitor of the electron transport chain. Which of the complex of the electron transport chain is inhibited by carbon monoxide? The answer is complex 4, also called cytochrome AA3. So that is the complex inhibited by carbon monoxide. Another molecule that inhibits complex 4 would be cyanide, also inhibits complex 4. Question 9 says, a 42-year-old obese female presented to the emergency center with complaints of worsening nausea, vomiting, and abdominal pains. Her pains were located on the mid-epigastric area and right upper quadrant. Blood chemistry reveals high serum amylase. So again, back to this same example. If inside of the blood there's high serum amylase, what tissue would likely be affected? The pancreas, and her symptoms are in sync with acute pancreatitis. Question 10. A 60-year-old chronic alcoholic was brought to the hospital with complaints of protuberant abdomen, that's ascites, and edema fit. He also had a history of hemorrhages. Blood biochemistry revealed high serum transaminases, low serum total proteins, that's albumin, and prolonged prothrombin time because the clotting factors that were in the liver, like 2, 7, 9, and 10, and the rest, are not being synthesized effectively. Urine analysis was normal. What is the possible diagnosis? This patient has cirrhosis of the liver. Question 11. A 2-week-old child was brought to the emergency. The parents were fearful that the child had been given some poison as they noted black discoloration on his diaper. A diagnosis of alkaptonuria was made and the child was given vitamin C as a supplement. Alkaptonuria occurs due to reduced activity of the homogentic acid oxidase enzyme. What is the role of vitamin C? Now, when homogentic acid is oxidized, it's going to make benzoquinoic acid. And benzoquinoic acid is what's responsible for the black coloration of the diaper. So what we do to allay the mother's fear of the black discoloration on the diaper is we want to prevent this oxidation process from occurring. So we are going to administer vitamin C. So vitamin C functions as an antioxidant. So this was actually meant to be an antioxidant. So option A will be correct if this was an antioxidant here. It does not work as a coenzyme. The enzyme involved in this enzyme does not have vitamin C as a coenzyme. Question 12 says, a 67-year-old army officer in good health previously presented with sudden pains in a great toe. Serum uric acid levels were high and the diagnosis of gouty arthritis was made. He was advised to bed rest. Painkillers and allopurinol was also given. What is the mechanism of action of allopurinol? So as I said before, the mechanism of allopurinol is this. Xanthine oxidase seems to be a very nice lady. Xanthine oxidase is the enzyme that converts xanthine to uric acid. And uric acid is the guy that does all the damages that causes gout. So xanthine oxidase is a very rich lady. So she meets the drug that was given, which is allopurinol. Allopurinol, okay? She converts allopurinol into an active metabolite called alloxanthine. But alloxanthine is a very wicked guy. Alloxanthine goes forth and then kills xanthine oxidase. So what happened was that xanthine oxidase unknowingly committed suicide by converting allopurinol to alloxanthine. So the mechanism whereby an inert molecule is made active by an enzyme, which then leads to the inactivation of the enzyme by the active molecule, is called suicide inhibition. Question 13. One of the following enzymes has absolute specificity for its substrate. Choose the correct option. Urease is the enzyme, has absolute specificity for its substrate. Which of the following is a substrate specific enzyme? Lactase is the answer. Question 15. Which out of the following is not a substrate-specific enzyme? Hexokinase is the answer. Group 1 coenzyme participates in which of the following reactions? Oxidation reduction reactions. Which of the following coenzyme takes part in hydrogen transfer reactions in electron transport chain? The answer is coenzyme Q. Question 18. The conversion of pyruvate to oxaloacetate involves the participation of dash as a coenzyme, biotin. Don't forget, we said there are 3 A, B, C enzymes in the body, which means they need ATP, they need biotin, and they need CO2. These enzymes that need these 3 things, we have pyruvate carboxylase, we have acetyl-CoA carboxylase, and then we have propionyl-CoA carboxylase also. So they are the 3 enzymes that use ABC: ATP, biotin, and CO2. Question 19. The drug fluorouracil is recommended for treatment of cancers. It involves a series of changes and then binds to the thymidylate synthase enzyme, resulting in inhibition and blockage of cell division. The mode of inhibition is still through suicide inhibition. Question 20. The activities of many enzymes, membrane transporters, and other proteins can be quickly activated or inactivated by phosphorylation of specific amino acid residue. This regulation is called covalent modification. So this is an end to paper 1, Enzymology review.